How does myofascial release complement laryngeal palpation in assessing patients who present with voice disorders?
Well, I think first we have to be very clear that if you're in a multidisciplinary voice clinic, particularly in this country, an ENT surgeon will palpate you, and their primary objective is to rule out cancer. Is the kind of number one thing that I would just like to say before we continue on that. So laryngeal palpation as a diagnostic tool in a voice clinic, in an NHS voice clinic, is mostly about, can we feel any lumps and bumps that shouldn't be there, any bits and bobs that should not be there. So that I would just like to start with that, if that's okay. In terms of voice disorders are such a broad biopsychosocial, they're very complex, particularly with elite singers, singers who are doing 8 shows a week in the West End or on Broadway. Mm-hmm. You're not in that part of New York, are you? But these singers who they not only rely on their voices to talk and communicate and have their message shared like we all do here, but they also rely on it for their job, but moreover their fans. They rely on it for a sense of completeness, I suppose. If we I started out as a dancer, and when I injured my knee, I really felt quite incomplete as an entity, as a human being. Mm-hmm. And so when injury occurs, we have this incompleteness. I think it means we can't be ourselves, right? So then when we kind of put our hands on somebody with meaning and with context, that can really change somebody, particularly if they have been to a voice clinic and it's been a very quick affair. They've gone in, they've got a diagnosis, camera down the throat, 10 minutes in, off you go. Because as an elite singer, you'd want to know more, you'd want to feel like you were listened to more, which I think is really important. The work is slow and gentle. Yeah.
And specifically the way the question is worded, I didn't word these questions, so myofascial is complementing laryngeal palpation for the assessment. Palpation gives us certain information. I think that often palpation is overstated. I think the findings with palpation are overstated. I can be somewhat obnoxious when I bring up some of the evidence that shows, for instance, that the intra-rater reliability with palpation is pretty poor, both in terms of coming up with an agreement on scales of muscle tension, right, as well as what it is you're palpating, right? There's a muscle there, but is that why there's tension there, right? Yeah. I think palpation is an effective diagnostic tool. It should be one of the tools.
Yeah.
I use palpation all the time. I just use it more for the beginning of a conversation versus the end of the conversation. A lot of times the palpation, the clinician finds it and that becomes what's wrong with the person. That's what we have to change right there, because I know what I'm feeling and you're high tone, there's tension there, so we need to fix that. When I touch somebody and if I feel something which feels tight or high tone or frozen chicken, as we talked about, to me that's simply the place where I then not tell you what I think I found. That's where I ask you, Stephen, what do you feel right now? When I found that, right, I'm poking, I'm prodding that spot, but what do you feel when I do that? And if it's not relevant and it's not familiar, then I move on instead of pathologizing that tone, which could be due to underlying skeletal asymmetry. It could be to underlying injury that had nothing to do with the dysfunction, right? I'm going to ramble here for a minute. I talk a lot about scoliosis and subscoliosis and the normalcy of spinal rotation, for instance, right? Yeah. And the normalcy of spinal rotation is that 98.4% of people, at least in this one very large study, have a spinal rotation to some degree. only 2% of them have it so great that it's called a scoliosis, right? But if you've got a cervical spine that in 98.4% of people, you've got mild to moderate to severe rotation, what does that do with tension patterns, right? It's going to change tension patterns, right? As the spine rotates, the larynx is going to go with it, or maybe it's going to choose to stay behind, right? We're going to one side tighter, one side looser. Same with the hyoid, right? Same with the cervical, with the skull. As those rotations change, you get tensional changes as well. Now, certainly some of those might have something to do with the person's problem, but if 98.4% of this one test that was done in 1,000 sample, do all of those people have a problem? Probably not, right? So put it all in perspective versus saying every asymmetry is problematic. So that's one of my issues with palpation as a key is the sole diagnostic measurement.